Using the Visigi tube during the creation of a vertical sleeve offers many options with regard to techniques. One option is to use the Visigi tube as a retraction device. The Visigi tube is advanced into the stomach in the usual fashion. The stomach is then easily decompressed. The tube is then advanced along the greater curvature of the stomach. The Visigi tube will adhere to the natural curve of the greater curvature. It is advanced until it creates retraction. The Visigi tube now can be used as a retraction device, as the greater curvature can be easily delineated. This technique is particularly suited for single port vertical sleeve gastrectomy. Here the Visigi tube is used along the greater curvature and delineates the greater curvature of vasculature and anatomy. It can be retracted anteriorly and laterally to better expose the greater curvature as well as the lesser sac. This dissection is carried up to the angle of His, where the Visigi tube is retracted anteriorly. This provides a safe method of dissection. Later, the Visigi tube delineates the lesser curvature by placing it along the lesser curvature. The Visigi tube can then be directed into the distal stomach by placing a grasper adjacent to the lesser curvature vasculature. The Visigi tube is then advanced into the distal stomach easily without manipulation. This technique is used to avoid distortion of the area of the antrum. The Visigi tube is placed just beyond the first staple line. And delineates clearly, helping to avoid encroachment on the incisora. This now allows for a straight line along the lesser curvature vasculature. This is provided by the Visigi tube, which is fenestrated circumferentially, allowing for delineation of the lesser curvature vasculature. The Visigi tube is then removed. It can be removed by anchoring the distal stomach and removing it. Another option is to insufflate air using the Visigi bulbs and then removing it.